Okay, and I'm glad that at this point there are more people joining. But welcome everyone. Good morning, good afternoon, good evening, depending on where you are. And I'm really glad to welcome you all to our second Big Tent call on climate and health. And my name is Shweta Narayan. I'm the campaign lead at Global Climate and Health Alliance and also the co-coordinator of Climate Action Network's Health Working Group. And this is our second Big Tent call, as I said. We had our first call in May in the lead up to the World Health Assembly and also to the SPs, UNFCCC's SPs in Bonn. In that call, we had a really great conversation around our expectations from the climate and health community leading up to these two important events in the calendar during the year. And we did end that call with a promise that we will come back to debrief from these two moments and also set the stage for what are the other important milestones or timelines during 2024. So here we are. And before I introduce other panelists and give you an outline of the conversation today, I have some housekeeping announcements. So first thing is that we have translation in Spanish. And for those who are not familiar with the Zoom, I'm assuming everybody's familiar with the Zoom instructions, but in the bottom of your screen, you will see a translation icon, and you need to click to English or Spanish. There, we are recording this call because we always get requests from people who wanted to join the call, but for some reason could not share it with them. Please introduce yourself in the chat box with your name, organization, and where you're from. And please use the question and answer box for any questions that you may have for the panelists. If you have any comments, we will have several moments in the call. We will invite all our participants to share their reflections or comments. So please respond when we open up that space. With that, the housekeeping announcements are over, and I want to invite my colleague Pooja Dave, who is the policy coordinator at Climate Action Network International, to start off and set the stage for this conversation and also reflect on the issues of climate justice, health justice, human rights, especially coming out of UNFCCC's SPs at Bonn. Pooja, welcome.
Thank you, Shweta, and hello, everyone. As Shweta introduced, I am Pooja. If you are quite active in the climate space and if you are a CAN member, you receive zillions of emails from me. So here is the face for that, because usually my face doesn't appear in the emails that I send out. First of all, before I set the context, I want to extend appreciation on my behalf and from CAN for all the work that the health community especially did during SPs. All the running, following, negotiation in all the rooms. Guys, you were all there. And I did share my appreciation with Jess as well. The notes that you all took were really appreciated. They were well framed, and it was very helpful when we were also not able to reach out in those last prime hours when negotiation went on for way too long. And so with that context, I would also like to flag that while health is a new issue that CAN has been venturing into, or we have been active since last, let's say, 1.5 years, Jess and Shweta has been quite instrumental in building bridges between the climate space and the health space as well, and the interface. And with that background, I would like to open this call putting one thing out there, that climate justice is something that is the backbone of all the work that CAN does. And what we really right now venture for or really want to see is health justice as well. Because when we talk about equitable or equity within the health space, it cannot be without health justice. And now in this current context, while we are experiencing so many extreme weather events, we cannot move forward with the health justice piece without linking it with the climate justice piece as well. I'll just give one example right now about the extremities that we are observing in terms of climate change, that while I sit here, take this call from Toronto in Canada, my hometown in India is getting flooded because of extreme rainfall with just like dramatic downpour that happened in last 2 hours, or for the fact that places like Toronto, which have the thunderstorm but have never experienced flooding, and we had fast flooding in last week because of the downpour in 2 hours, and the infrastructure was not ready. The thing is that when we talk about infrastructure not being ready for this extreme event, what also follows up that when infrastructure is not ready, when there is water logging, there are health crises related to it. And all this eventually gets connected, and that connects the whole equity and justice piece within the whole framing as well, and the entire interface. And while there are more and more increased evidence, we still feel that health within the climate space is not at that level that we envision it to be. There are low-hanging fruits, or there are those entry points within the climate space through different agenda, but health in itself has still not been prioritized to a level that we really want to see, understanding the current context. Because whatever we talk about, whether we talk about climate related impact, we talk about addressing impacts, doing more on adaptation, addressing loss and damage, health is a priority over there, and it's a direct link. But even when we talk about transitioning away from fossil fuel, there is potential health hook which is still not identified and explored, and still we need to do a lot more to really bring those conversation within the climate space, especially around the UNFCCC space. What we saw at SBs, and also that is challenged when we go into technical session like SBs, that SBs are really technical sessions. If you don't have a technical agenda, most potentially those issues are not discussed or are in side conversations. And at this particular SBs, there were hardly any room to have any conversation around health. Even in the light of the important decision that came from World Health Assembly, there was least acknowledgement in terms of the overall SB framing as well. And there are very high risks. While from COP28, we did get a health declaration, and building on the momentum, what work we need to collectively do is from now till Baku, if we can further strengthen that momentum, take those things forward and really build those hook within the ongoing process through different entry points on health. And that's the most important two-piece challenge that I leave with, that how we strengthen this interface between climate and health, and how we link it with the justice issue that we are currently in or are striving for. And back to you, Shweta, with that.
Thank you, Pooja. Thank you so much for setting this context. I was taking really, really copious notes because this is basically the work cut out for CAN Health Working Group and the wider climate and health community. So, thank you so much for setting the tone and setting the context. And I really appreciate. I know that you will have to leave shortly, but I really appreciate that you've taken this time to start off this conversation today. Just a quick, again, sort of setting what this the rest of 80 minutes or so is going to be like. We are going to reflect. We're going to debrief from Bonn. We're going to have we have expert speakers and guests who will talk about the World Health Assembly resolution on climate and health and its implication. We will then also talk about some of the upcoming key global moments like the G20, the New York Climate Week, and this UNGA, and also the Plastics Treaty and CBD, the Convention for Biological Diversity, and how health and climate and environmental conversation sort of intersects, and what can the climate and health community do, and where are the opportunities for us to intervene to strengthen the health argument. With that, I would like to invite my colleagues, Jess Speakley, who is the policy lead at Global Climate Health Alliance, but more importantly, partner in crime with the CAN Health Working Group as the co-coordinator, and Milena Sergieva, I'm sorry, I might mispronounce your name, who is the liaison officer at for the LAC region at the Global Climate and Health Alliance. And for both of you, just because you were so closely following the UNFCCC process and were at SB SBs in Bonn, I my question to both of you is like to share with us is like how did health feature at the SBs, and also kind of reflect in your intervention what were the health implications of the negotiation itself. What do you think are the opportunities after SBs and on the road to Baku? And definitely talk a little bit about what are the potential roadblocks or hurdles that you see that need to be collectively overcome or strategized so that we could effectively highlight the health argument in climate action. So welcome, Jess and Milena, and over to you.
Thanks so much, Shweta. And I wonder if we could just skip forward a couple of slides as we get ready for the next segment. But to respond quite broadly to your question to start with, Shweta, I think reflecting on how health was addressed in Bonn by parties, we certainly didn't see as much on health as we would hope to see on health, but there was a huge uptick in the number of parties that did talk about health and the quality of those health mentions. We're not yet seeing that translate into healthy climate action, but the parties that are speaking about health are speaking about it in the context of the agenda items that they're most ambitious around, and you'll see that come out in what Milena and I present in the next couple of slides. And this momentum is only going to build on the way to Baku. We've heard confirmation that there will be a health day of sorts at COP29, similar to what we saw at COP28. And the health day theme will be shared with other themes. It will be on November the 18th, and it will cover the themes of human capital, children and youth, health and education. And of course, all of these themes are intrinsically linked, but it's really crucial that we do consider health to be much wider than human capital alone. People's lives cannot be defined by their economic gain or their economic cost or their economic contribution. So really important that we lead with a human rights-based framing to health throughout that day and in the lead up to COP as well. And also recognizing the fact that the venue for COP29 may be challenging in some respects, especially given some of the human rights history of Azerbaijan. So also worth being mindful of, and especially given the focus of much of the call today. Happy to move on to the slides and pass over to Milena now. Thanks so much, Milena.
Thank you, Jess and Shweta. Hello, everyone. I'm Milena Sergeyeva. I'm GCHA's liaison officer in Latin America and the Caribbean. I'd like to share some developments from the recent SB60 negotiations focusing on adaptation, loss and damage, children's dialogue, and gender. First, on adaptation, although health adaptation needs were mentioned in several negotiations rooms, at SB60, they were not explicitly included in the discussions on the global goal on adaptation. And milestones for health were achieved at previous COPs, where health was indicated as a thematic target in the UAE framework for global climate resilience, which was adopted at COP28. This framework should guide and strengthen efforts toward reducing vulnerability and enhancing adaptive capacity and resilience, as well as the collective well-being of all people, the protection of livelihoods and economies, and the preservation and regeneration of nature for current and future generations. And through this thematic target on health, we will be able to measure progress on adaptation for health across different sectors. And what specifically is contained in the health target. So in order to pursue the objectives of the framework, parties should increase their ambition by 2030 on 7 targets, and one of them refers to health specifically. And it says, attaining resilience against climate change related health impacts, promoting climate resilient health services, and significantly reducing climate related morbidity and mortality, particularly in the most vulnerable countries. So this was agreed upon at the previous COP. And during SB60, progress was made in defining the modalities or the work plan for the UAE Belen work program. A key outcome was the agreement to compile and map existing and new indicators to measure progress. The SB chairs will deliver a report on this by May next year, and submissions for parties and observers are invited by the end of this month, July 31st, with potential for further contributions later. A hybrid workshop is expected to be scheduled before Baku, and there will be input from a diverse group of experts, including regional and gender-balanced representation, indigenous knowledge holders, small island developing states experts, least developed countries experts, and research organizations. After Bonn next year, when the indicators report should be ready, 2 other hybrid workshops will be held to further refine them. And however, there are some challenges. The group of experts where exactly the opportunities is for health experts to be nominated might be narrower than suggested by developing countries. There is also an issue with the participation and the role of the adaptation committee that was very much discussed. The concerns by developing countries is that the adaptation committee is comprised by negotiators and should not weigh in too much into the work of the technical expert group. And additionally, some gaps remain, particularly regarding the means of implementation indicators. The inclusion of these indicators was opposed by developed countries. Moving on to loss and damage, at SB60, the 3rd Glasgow dialogue session took place, and so many contributions on health. Palau emphasized the human element, focusing on women and children, housing adaptation, and the need for health system preparation. They highlighted mental health and substance abuse issues post-relocation. El Salvador provided cost calculations per sector for loss and damage, not for the health sector, unfortunately, but noting disruptions to health and education infrastructure. Senegal discussed non-economic loss and damage, particularly affecting the health and income of women, and the difficulties in calculating the non-economic costs, which was confirmed by many other countries. Peru called for intersectoral collaboration with the health sector. Maldives focused on well-being and livelihoods, and other countries made general comments on the impacts and of climate change on health. And overall, developing countries stressed the need for filling the loss and damage fund with new, additional, and predictable funding. Both developed and developing countries called for human rights-based approaches, inclusivity, and gender considerations on loss and damage. And another point of the loss and damage conversation was the Warsaw International Mechanism on Loss and Damage that is due a review at SB61 in Baku, with opportunities for submissions on its functionality and objectives by September 30th this year. Parties agreed on the need to strengthen coherence and synergies between the Loss and Damage Fund, the Santiago Network, and the WIM. The Santiago Network and the WIM have a role in technical assistance and sharing of information and good practices between countries, so there's a role for health experts in there too. On the dialogue on children, in the children's dialogue, almost every intervention focused on the physical and mental health impacts of climate change on children, with presentations from the IPCC, Lancet Countdown, the UNICEF, and the only child present in the dialogue, Francisco Manzanares from Colombia. And another big focus of this dialogue were children's rights. Fiji, for instance, emphasized the need for resilience of services such as health, water, sanitation, education, nutrition, and social and child protection. Bangladesh raised concerns about the reproductive health of adolescent girls, noting a trend in early marriages due to health complications from young pregnancies. Nigeria also highlighted the health impacts on girls. And finally, a word on gender. There were significant challenges with Russia blocking negotiations on the concept of gender, particularly challenging the concept of gender. Despite this, the rest of the room had a consensus on the importance of including the right to health in the gender text, and also to acknowledge the right to a clean, healthy, and sustainable environment. And with this, the text was taken to the next SB to continue discussing. With this, I turn to Jess to talk about other negotiation streams.
Thanks so much, Milena. I'll kick off with mitigation. And often when we as the health community speak about mitigation, we focus on the co-benefits of mitigation, but in terms of better air quality and healthier diets and increased physical activity from interventions to reduce emissions in the energy and food and agriculture and transport sectors. But we miss the fact that actually mitigation is so crucial for reducing the progression of climate change, and as a result, reducing the health impacts that result from it. And it's so important to hold these two together. This was really reflected in the interventions that came from parties during the negotiations. So the Africa Group of Negotiators referred to those climate impacts under the discussions on mitigation, and made links between malaria and the need for mitigation. Australia, in conversations on just transition, spoke about how reaching net zero leads to better health outcomes. A similar intervention was made by the European Union, links between the just transition and air quality and the right, again, to a clean, healthy and sustainable environment. I've headed this slide mitigation, but I'm going to talk about multiple streams. So about the mitigation work programme and the just transition work programme, like I've just mentioned, but there was also some mitigation content in the global stocktake decision that was adopted in Dubai at COP28, and some of that is relevant to next steps as well. So in terms of some of the gaps that we saw in what was agreed in Bonn, it was really challenging to make any progress on the mitigation work programme, the standalone mitigation agenda item, and actually it was completely postponed until COP. It wasn't even possible to agree on an informal text. Although there was progress made on a just transition, developing countries really wanted there to be an explicit work plan within the work programme specifying how this just transition is going to be achieved in quite granular detail. However, this wasn't something that came to pass. It wasn't agreed either. So there really needs to be strong commitment from developed countries on how developing countries are going to be supported to make these just transitions, given that this is going to be so crucial for health and for equity more broadly. Some governments also blocked discussions on this agreement that was made in the global stocktake in Dubai with language on transitioning away from fossil fuels. And they said that it belonged just in the global stocktake decision, that it couldn't be taken forward to other work programs for more detailed discussion and working out how it was going to be possible to implement it. Turning to next steps and opportunities in the lead up to COP, as we've seen in recent years, it's sure that there will be continued campaigning by climate groups on ending the fossil fuel era and making sure that that is done in a just and equitable way. It's so valuable to add health backing and health amplification to those messages, to be really emphasizing the human impacts and the human opportunities of those transitions. also really key to be emphasizing that we need to maintain and improve access to safe and affordable and reliable access to energy, because without that, we know that we won't have good health. So that's all part of the just transition conversation. There will be submissions both at the end of this month and also in the month before COP29 on the Just Transition Work Programme for anyone that would like to engage with those opportunities. And then there's also a dialogue on the mitigation work programme coming up once more before COP in Baku as well. If we move to the next slide to touch a little bit on finance, which absolutely underpins every aspect of necessary action on climate and health, including in the UNFCCC negotiations. We didn't see health come up specifically in the discussions in the finance room, but parties are making the links between finance and health, not least in the opening plenary, where the Africa group of negotiators noted that it's having to spend more on, the countries in the African region are spending more on debt than they are on health and education. And they really underscored the need for this new finance target, the new collective quantified goal, to be an ambitious one. And this new collective quantified goal is going to be what replaces the 100 billion target that developed countries committed to providing to developing countries. That's $100 billion annually by 2020. That target wasn't met. Most sources suggest that it has been met by now, and there is still some discrepancy over that. But the important thing to mention is that really the level of climate finance needed is orders of magnitude higher. So it's really crucial that this new collective quantified goal is an ambitious one. Progress in Bonn was totally insufficient as well, given that this new collective quantified goal is due to be agreed at COP29, which means there are really complicated details to be defined in the next 4 months. Part of the challenge here was that the negotiators in Bonn are slightly more junior than the negotiators at COP, and sometimes even head of state intervention is required on issues of this magnitude. Nonetheless, these are the outstanding issues. So quantum, the new number, what is the number that is going to replace the $100 billion? A number of developing countries were calling for figures of over $1 trillion or around $1 trillion. It's likely that the actual number needed may be even higher. There'll be more on that later this year from different advocacy groups. How is this overall number, how is this trillion going to be divided between different aspects of climate action? The 100 billion covered mitigation and adaptation. There also needs to be allocation for loss and damage, and it's not yet clear whether there will be sub-targets and how loss and damage will be reflected, given that the loss and damage fund is much newer. There are issues over the quality of the finance as well as the quantity. As mentioned by the African group of negotiators, the issue of debt when it's attached to climate finance loans that have unaffordable interest rates, that triggers cycles of debt and poverty and ill health. So it's really important that that finance is grants-based for the vast majority. In terms of contributor base, these are the countries that are providing the climate finance. Historically, that's been the highest emitting countries. There is a suggestion to expand that group of countries, which is proving highly contentious and holding up a lot of the progress on the discussion. Developed countries would also like to expand the discussion on finance to wider financial flows, so not only the obligations of governments, but looking at private sector flows as well, for example. But in fact, any discussion under the UNFCCC, it's difficult to apply that to the private sector because the agreement is among governments. Recipient base, who receives the money, is potentially slightly less contentious than the contributor base, but still something that is going to need to be carefully defined. In terms of next steps and opportunities, so this will be going up to the next level. There is a heads of delegation level retreat in Azerbaijan later this week, and that will have a focus on the new collective quantified goals. So the hope is that there will be progress made there. but also we're expecting really strong campaigns from different climate groups on the NCQG and on finance more broadly, with messages around making polluters pay and the potential for a climate damages tax. So please do support and amplify those wherever you can. And I'll pass back now to Shweta and hopefully hear from all of you on the call as well. Thank you so much.
Thank you so much, Milena and Jazz. I think this was an absolutely fantastic unpacking of what all happened at Bonn this year, and a really good detail breakdown. I am just keep going back to a comment that Jess you made, which is that, definitely we saw momentum, and the presentation showed that there is momentum from the COP28 Declaration, the World Health Assembly resolution that we will be talking about now in the next segment. Health was mentioned, and at the same time, we need to see outcomes of these declaration in form of sufficient action, which prioritize climate justice and health justice. So a lot happened, and a lot more in terms of critical conversations in the next 4 to 5 months, which will be very, very crucial in defining where we get to with these processes and action. I know that we are, we have a packed agenda today, and also we are a little behind time, but I want to invite at this point, if anybody from the audience has any burning question or suggestions or any observations to make, maybe we can take 1 or 2 comments, and then we can move on to the next segment. So now is the moment. If you have some really, urgent interventions, you could raise. Sorry, Kelly, please come in.
We might need to unmute Kelly.
I did that. I did that.
Thank you. Thank you. Hi, everyone. Thank you so much for a fantastic presentation and overview. And most of that specific detail out of Bonn was news to me, and just hugely appreciate the summary presentation. My question is on the finance bit, and I guess a 2-part question. One, I'd be curious if you could share, who are the main parties who are supporting the agenda setters and the COP29 leadership on the issues of finance? And secondly, what is the role of the banks and development finance institutes in helping to move these targets? There are a lot of, you're probably aware, of collaborative initiatives led by the World Bank, but including GCF and other climate funds and other development banks and other finance institutions to set new investment frameworks. And it seems to me that discussion isn't happening completely in sync with the UNFCCC specific policy progress. And just wondering if you could comment on that, and if there's any way we could help. Forecasting Healthy Futures is involved in supporting those collaborations, and would love to find ways to make their progress relevant here and in sync.
Thanks so much, Kelly. I can't remember off the top of my head who the co-facilitators were for the NCQG discussions in Bonn, but I'm happy to look that up and send that to you. So that's the countries that have some sort of shaping role. And in theory, every party under the UNFCCC does have equal weight, but we see again and again that the most developed and historically most powerful countries do have the capacity to overrule what developing countries might be calling for. So we see, a lot of sway from the US and from the EU as well, in terms of the ways that the discussions progress. In terms of how this relates to the GCF and the World Bank, and I'd love to be corrected on this if anyone understands differently, but the NCQG will be negotiated by parties. I'm sure that there are experts within the GCF that parties can consult with, because that finance will be distributed by the GCF. But I think most often we would be expecting parties telling the GCF what to do rather than the other way around. But I'm sure there are behind the scenes conversations in addition. Thank you.
Thank you so much.
Thanks, Kelly, and thanks, Jess. I think we can take one more intervention. I see Bidhan. Um, Bidhan, please come in, and then we'll move on to the next item on our agenda.
Sure. Thank you very much for providing me the opportunity. This is Bidhan Chandropal. I am from Bangladesh. I am the founder and managing director of Prabha Aurora. And I will be very happy to get an answer to my question, which I wrote in the comments, and I am still reading it. Actually, Geneva, Bonn, in the light of past experiences, can we publish a comprehensive publication for Baku on behalf of the Global Climate and Health Alliance this time? Such a publication seems to be very necessary for everyone's understanding and of the entire scenario, and also for advocacy on them. This is one. And another one is, how can we learn more about climate financing processes and procedures? How can our organizations, or like our organization, many things more, strained by getting funding, making examples and presenting them to the next COP, because we are out of the scenario. We don't know how financing is coming to our country and how it will be utilized. So please give some lights in this regard. Thank you very much.
Thanks, Bidhan, and thanks so much for joining. So GCHA will be working both with other members of the Cannes Health Working Group and members of the health community outside Cannes to come up with a list of recommendations for COP29, as we did for COP28 and for COP27 as well, and would love to get people's input into those. So we need to match up the consultation process within and outside Climate Action Network. But last year, we were able to have everybody singing with unified messages. So really, really thanks to everyone for the cooperation on that. And I think it really contributed to making sure that we had well-rounded health messaging that didn't just focus singularly on mitigation or adaptation on loss and damage. We were able to make the case for all at once. To the financing point, we found being part of Climate Action Network, and I'm not just saying that because this is a Climate Action Network call, incredibly valuable for building a very limited understanding of finance. There are finance experts within Cannes, and by joining the finance working group, it's possible to get into much more depth on that. I think it's also really important for organizations to look at financial opportunities and funding opportunities outside of the UNFCCC process, recognizing that it will take a long time for that finance to trickle from the institutions that distribute it to national level and then to organizations at subnational level. So yeah, hopefully the new collective quantified goal will be incredibly ambitious, but even then acknowledging that it might not manage to reach the ground at the pace that many of us need.
Thank you, Jess. I'm certain that we can have like a full dedicated conversation on the UNFCCC processes and the opportunities. But in the interest of time, I'm going to move on to the next segment, which is unpacking the WHO processes that have happened in the last 2 months. And those who attended the first Big Tent call would recall that we had our colleague Rosie Tasker, who gave us a wonderful overview of what was expected. Rosie unfortunately could not be here today, but then she sent a recorded presentation where she's going to again unpack for us what was agreed in the World Health Assembly, the 77th session with respect to the climate and health resolution and the global program of work 14. And then she will also help us navigate through the next steps from global, regional, and national level, and what they look like. And after Rosie's presentation, we have a special guest who I will introduce after the presentation with us, who is going to help us unpack that even more in detail. So over to the recording from Rosie's presentation. I am not able to get the audio. Do you guys get the audio?
Not just yet, but I can also put a link in the chat if it helps. One moment.
Yeah. Melina, just see if the audio is working.
Yep. Hi everyone, and thank you so much for the opportunity to present today. My name is Rosie Tasker. I'm the Clean Air Liaison here at Global Climate Change and Health Alliance. Over the next couple of slides, we wanted to give you a really quick debrief on what happened recently at the World Health Assembly. So as many of you will remember, the official agenda contained a number of climate change and health related items, most notably the Climate and Health Resolution, and also WHO's General Programme of Work, which we'll run through in a little bit of detail. But I also wanted to flag another resolution on maternal and child health, which saw the inclusion of climate and health language, in no small part due to the extensive advocacy by a lot of civil society partners. And WHO also held a roundtable discussion, which you can access at the link on the slide here. But alongside that official part of the agenda, we also wanted to celebrate that this year we saw unprecedented focus on climate and health at the World Health Assembly with 19 unofficial side events. So it's a real step up and it's a really exciting trend. So moving to the resolution, it was co-facilitated by the Netherlands and Peru with support from Barbados, Kenya, UK and Fiji. It was officially adopted in the evening session, very close to midnight on Thursday, the 30th of May. And over the course of the discussions, we saw additional support from 38 WHO member states from every single region, which was amazing. Since then, we understand that a number of other member states have joined on to co-sponsor the resolution, which should take the total near to 50, and we hope to be able to share that list with you shortly. GCHA has a summary of the discussion, which you can access at the link just here. But I think some of the major themes were the breadth and strength of the support for the resolution, with Russia being the only dissociating voice. And that really stems from concerns around WHO's engagement in the space more generally, with some very specific comments on WHO's engagement with the plastics resolution. But by and large, support was overwhelming. Several countries mentioned the national impacts of climate on health already being experienced, so particular focus on heat, vector and waterborne diseases, flooding and displaced populations, amongst many others. And it was really exciting to hear how many different national responses are taking place, but also the initiatives that governments have in the pipeline. Over the course of the discussion, there was a really strong focus on adaptation and particularly building the resilience of health systems to the health impacts of climate change. But mitigation was also raised by several governments. And a lot of this took place within broader calls for greater technical support from WHO and other international partners. Kind of a central theme throughout a lot of the interventions was the really inequitable nature of climate change, and particularly the health impacts of climate change. And as a result, the critical importance of having an equitable and just response. And a lot of member states kind of picked up on the need for better financing within this, with direct references to common but differentiated responsibility, which was language that was actually possible to be retained within the resolution, which was no small win for a health resolution. A number of member states highlighted the importance of a coordinated response, and there were a number of references to the importance of kind of One Health within that, and 3 or 4 references broadly to planetary health.
Apologies, I will start again. So let's see if that changes.
One thing that was quite surprising, I think, over the discussions were the limited references to fossil fuels as a public health issue. But it was amazing to see that being raised in the regional statement for the African region. So that was 47 member states, Spain and the Netherlands. So I think the most critical question is now what happened. So the resolution proposes a number of non-binding actions that member states should take. I think some of the key ones within this are to conduct regular V&As with a view to development of health national adaptation plans. Alongside that, to develop national action plans more generally to ensure the environmental sustainability of health systems. There were some very specific requests around better integrating climate data into existing monitoring and surveillance systems, with a push to member states to really disaggregate that so that we know that health system responses and the climate response more generally is pro-equity, and we can really track how that's being implemented. And there was also a number of calls for supporting better research. Attach was a major theme, and the resolution asks member states to endorse it, and also to foster more multi-sectoral cooperation, which is a really key thing, because we know that health hasn't been as good at engaging with other sectors, and likewise other sectors engaging with health. But the resolution doesn't simply apply to member states. There are a series of actions for the WHO itself. I think the key one that we wanted to flag with you was the development of a global plan of action on climate change and health. So that's really going to be kicking off in the next month or so, with consultation with member states and non-state actors in late summer 2024. The details on that are fairly limited at the moment, but we'd be delighted to keep everyone up to date if you're interested in that. GPOA will then be discussed in January and then noted and adopted at WHA in May. But I think the really exciting thing about this is that with the adoption of GPOA and GPW14, which we'll come to shortly, we're likely to see a lot more kind of regionally focused discussions. Alongside the pieces within house for WHO, there are also a lot of calls, or a strong call, sorry, within the resolution to see WHO engaging much more on global level discussions, which could mean that we see WHO much more active at events like COP, with COP processes. So GPW14, we wanted to sort of flag this with you very briefly. These plans shape the work at the WHO at all three levels of the organisation. And they really help to identify kind of the strategic priorities and direction of the organisation. For the first time ever, GPW14 includes climate change as one of its 6 strategic priorities. And alongside WHO taking more action on that, it also means we're going to be seeing more reporting, more data coming out from WHO alongside the reporting specifically associated with the resolution itself. So these are under strategic objective on climate change and health. We're likely to see 2 joint outcomes. More climate resilient health systems addressing health risks and impacts, and you can see the actions under there, and lowering the carbon emissions of health sectors and societies and contributing to health and well-being. Now, the reason we wanted to flag this with you is that the development of these joint outcomes is also going to lead to the development of results framework. And we think that there's a really exciting opportunity to try and better align this with discussions around the global goal on adaptation. So thank you all for sticking with me. It was a short talk through the WHA. If anyone has any questions about what happened at WHA, please do reach out via email. And I wish you all a fantastic call. Thank you so much.
Thank you, Milena, for sharing the screen. And we apologize for the technical glitches that may have been there. We have also shared the link to this recording in our chat. So for those who would be interested, can look at this video later. And one thing that Rosie in her presentation mentioned was, a lot of focus on local level and regional level actions. And to unpack a little bit on that, we have a special guest today. We have with us Dr. Karen Paulson, who is an advisor on climate change and health with the Pan American Health Organization. And Dr. Karen, I'm not going to read the long, impressive bio, but just quickly to introduce Dr. Karen. She is a climate and health specialist with over 27 years of public health experience, working at all levels, local, national, regional, global. And in her current role, Dr. Karen works with the health sector and other stakeholders in Latin America and the Caribbean to strengthen their capacities to prevent, prepare, and respond to the impacts of climate change on health. And the focus, of course, is to reduce health inequities. So welcome, Dr. Karen. Really glad that you've been able to make time to join us. And just taking this conversation and the presentation from WHA, what happened with the Climate and Health Resolution at WHO forward, we wanted to hear from you. How do you see this resolution relevant for the Americas, and how does it contribute to the momentum for climate and health work? What are your thoughts?
Thank you very much, Shweta, and thanks to everyone for this opportunity. Good morning, good evening, good night, wherever you are from. And so I think this is exciting times for us. And in terms of the resolution, it's definitely very relevant for the Americas. As was said before by Rosie, in terms of how it all started and the call for this resolution and so on, included member states from the Americas. So it's very relevant in that the Americas also, as we know, is one of the most vulnerable regions because of its susceptibility to extreme weather events, that many of our economies are dependent on climate sensitive sectors such as agriculture and tourism. And we have very high levels of social inequality. And as we know, more importantly, climate change then threatens to exacerbate what already exists in terms of health inequities in the region, with our populations and territories that are in situations of vulnerability being affected, including small island development states. And we realize that these impacts are disproportionate. And there was mention of climate justice and so on. As Rosie said, the resolution is speaking to it's an urgent call for action to address one of the major threats to public health, and that of climate change. The situations highlighted in the resolution and the issues and challenges related to climate change also impact the health and well-being of peoples in the Americas. When we look at the increasing frequent weather events, many would speak about what's happening now in different parts of the world. But in the Americas, we're still talking about Hurricane Beryl, which just a few weeks ago impacted several islands in the Caribbean and areas of Mexico and so on, being the first huge storm to form so early in the season. And then when we talk about increasing vector-borne diseases, which is also highlighted in the resolution, we're seeing that for us, the number of cases of dengue so far for this year has already exceeded the total number recorded in all of 2023. It also recognizes the limited access to finances that is very critical for us, especially in the Americas, and hence the need for actions for mitigation adaptation to strengthen climate resilient health systems. And this is where we the Pan American Health Organization and World Health Organization focuses in terms of helping and building the health sector. So as was said, the resolution was adopted in May, and it is contributing to the momentum for climate and health work, as it follows on agreements that were made, declarations in the Climate and Health Declaration last year, in COP, the Health Day, and the health focus in different conferences and meetings that are coming up. So our member states are saying to us, we need to act, we need to do things fast because time is against us. We're in a crisis actually. And so there has to be movement. And so this resolution, I believe, has added to the momentum. And so the work that we're currently doing in Latin America and the Caribbean, focused on strengthening climate resilient health systems, is encapsulated in the resolution, in that we're already working in areas to strengthen the health sector to be able to more effectively engage in climate change discussions. As has been mentioned before, it's like, health is trying to make the case, health is trying to come up to speed, so to speak. And so that this is the area of governance and leadership where we're working with countries to help to promote that collaboration, not only within health, but between health ministries and other sectors at national levels and regional levels. We're also looking at the area of strategic planning. As was mentioned in resolution, one of the asks for the countries is for the development of health national adaptation plans and the conduct vulnerability and adaptation assessments in order to be able to identify where the most vulnerable and at-risk populations are for targeting interventions. We're also working in the area looking at the integrated surveillance systems and the development of early warning systems for climate-sensitive diseases. Research and capacity building is another area, looking to gather the evidence, increase awareness, and the health co-benefits also mentioned in the resolution, looking to make the case for investment and, of course, finances. In this area, we're working with countries, more specifically the ministries of health as our focal points in countries, but we do work with other stakeholders too. But to help the ministries of health and the countries in terms of developing capacities to be able to write project proposals, to develop a pipeline of proposals so that they're also able to access funds for implementation of the climate actions. And of course, when we look at the area of mitigation in terms of health infrastructure, knowing the contribution of the health sector to greenhouse gas emissions, then working with countries to ensure that that is reduced from the health sector. And so to assess and conduct assessments of greenhouse gas emissions and to make recommendations for lowering that to make them more carbon resilient. So all of these are captured in the resolution, which is calling also on WHO to support member states. And this, I think, gives us the impetus to continue and to scale up the current actions. Thanks.
Thank you, Dr. Karen. I think that was just amazingly comprehensive and gives a complete picture of the momentum that we are seeing indeed after the WHO resolution. And as you rightly said, time is of the essence. I just wanted to quickly seek your thoughts on, I mean, you laid out the infrastructure from WHO, the momentum and the member states, and how WHO and PAHO are supporting member states in achieving the vision set out in the resolution. How do you see civil society members, climate justice movement, health justice movement, environment justice movement members lend their support in achieving this agenda? Like, what are your quick key thoughts around that, and how can the community over here, the audience, can support in advancing this agenda for you?
Thank you. As was mentioned by Rosie earlier, there are several consultations that will be taking place in relation to the WHO resolution. But also PAHO has a policy. I'll quickly mention that PAHO is also working on a policy to strengthen health sector action and climate change with equity. We realize the importance of inclusion of equity here. And so actually one of the lines of action in the PAHO policy looks at creating awareness and strengthening community and civil society participation on climate change and health using an equity and human rights oriented approach. So I think it's very much in line. How can civil society participate in this or support? I think in the engagements, in the consultations, to listen out for the calls and to be actively involved, to participate in intercultural dialogues and so on, for sharing of knowledge and best practices to help to develop that bank of evidence that's needed to make the case. In terms of the communication and awareness raising of the linkages between climate change and health, I think civil society has a role in this in terms of helping in the design and the implementation of whether it be health promotion or materials or training programs, and also hosting sessions, community sessions and dialogues and so on to increase that awareness. And of course, I think in terms of being there at all stages of policy making, from the formulation to evaluation, civil society engagement is very important. And I think finally, I will add, in terms of the research also, the citizen science approach is coming to the fore as one of the methods through which we can also get that information, especially from the grassroots level, that will help to make whatever policies and decisions more all-inclusive, so to ensure that no one is left behind. So I think those are some of the areas, and of course advocacy are some of the areas I think that civil society can help to support.
Thank you, Dr. Karen. I think that was amazingly comprehensive and enough I think we have enough ideas and guidance in the civil society to follow up and support the initiative. I do see a hand raised in the chat, so I'm gonna have one question, and so we have Kurt who has his hand up. So yes.
Thank you. I think I've been unmuted. Thank you, Dr. Paulsen, for your very comprehensive presentation. I have a specific follow-up question. How can WHO, PAHO, use the ATTACH committee to develop health indicators that go beyond the healthcare system and beyond adaptation? And how can they bring these indicators, once developed, to the COP negotiations? She's muted.
Dr. Karen,
sorry, yes, I was talking away and muted, sorry. So with respect to the engagement in ATTACH, well, as I think you know that that the ATTACH is a WHO mechanism that was established, and PAHO is very much a part of. I think in terms of working with the ATTACH committee, that is something that we're actively doing as we're looking to develop the plan of action coming out of the resolution, and then also to have the indicators which would go along with the plan of action. So this is where we're at in the process right now, bearing in mind the resolution was only just approved in May. And as Rosie mentioned, the consultations for the plan of action have started at the regional level. And not only will health be part of the consultation, but also non-state actors. So there is that opportunity there. But this is where we're at in the process. I'm not sure if they'll be ready for presentation to COP, but I'm sure something will be presented at COP. But at this time, I can't say exactly what.
Thank you.
Thanks. Thank you, Dr. Karen. I see two more hands. So, I mean, I think this is an important conversation to be had. So I am going to invite Liz and Amelia with their questions, and then we'll move on to the next segment. Liz, over to you.
Thank you, Shweta, and thank you, Karen, for your presentation. My question is about funding. The World Health Assembly will agree to various decisions, including for the Secretariat in Geneva, as well as for what member states should be doing next and into the future, including for a year's time and then beyond a year. How has the funding, what is the funding situation for member states to action this resolution, and what are gaps and needs there?
Thanks. In terms of funding, I think well, most may be aware of the pledges that were made at COP, but they were pledges. And from that, the ATTACH also has a finance working group that's looking at how at mobilizing additional resources for implementing actions and activities coming out of the resolution. Because as I mentioned before, so the actions in the resolution all are not necessarily new. It's work we have been doing for a while. And so what we've been doing through ATTACH, through engagement with the banks, through engagement with the Green Climate Fund, Adaptation Fund, and others, actively working to develop the proposals in conjunction with the countries, with the member states, for the acquisition of resources. So currently, of course, there's a huge funding gap for climate change and health. But currently, the work that's going on, we're doing it through funds that we would have acquired through the Green Climate Fund for some countries in Latin America and the Caribbean, and also through entities like the European Union. We're constantly engaging and dialoguing with other partners for funds to be able to assist countries. So this is one of the things that we're doing constantly, but of course recognizing that there is indeed a gap, and so the constant need for us to be looking also at other sources from which funds can come. So we're helping to mobilize from the international standpoint, but also encouraging countries to themselves put funds in their national budgets to be able to implement some of these actions.
Thank you, Karen.
Okay, then. Thank you, Liz. And Amelia, your intervention before we move on to the next segment.
Hello.
Yes, we can hear you.
Yeah, Emilia from Liberia. I was just suggesting on the health of including the health into the whole climate change process, because we are also looking at how it is have been affecting young people within Liberia when it's come to the climate change and health. So I was suggesting that we can also include the health into this whole process, and not forgetting, even if we have the COP 29, we can also talk about this, the plastic bill of water that affected young people in the rural area, and also including our grassroots institution to this platform that will help in promoting the health of climate change in Liberia around the world also. That's what I think.
Thank you very much for that contribution. Just to mention, the Attach has a community of practice, and so there also we're looking to share best practices, experiences, and stories from different regions. And so I think this is an avenue also where you can access resources to assist in this area, but also, of course, the point being made that the need to include health in climate change. And that's a lot of what I'm sure CAN is doing, and we're also doing, coming fairly new on the scene, health into climate change, to strengthen the health arm and the health argument for climate change. Thank you.
Thank you, Dr. Karen. It was just amazing to have you, and we hope to have you in more of our sessions. Your insights have been wonderful, and this conversation has been very engaging. So thank you so much for taking your time in the morning and joining us.
Thank you.
Thanks. And now we will move to the next segment, which is basically events to look forward to, big moments in the remaining of 2024. I'm seeing a lot of comments in the chat on plastics, and we have 3 amazing speakers who are going to reflect on various moments, starting from G20 and also the CBD COP and the plastics treaty. So there's a lot more that this session has to offer today. Now, we know that the New York Climate Week and the UN General Assembly is in September this year. We have developed, or we are in the process of developing, a resource mapping sheet where we are going to put in, and we invite all of you to put in events that you know of, or events that are going to focus on climate and health at the New York Climate Week and UNGA. I'm going to share the link in chat. Please add anything that comes to your mind that has been around. We have added some events that we know have been announced and are to look out for, because they will look at the intersection of climate and health. But we will also like to invite you all to contribute to this sheet that we are developing, and we will be sharing this with everybody closer to the New York Climate Week. And with that, I'm going to move on to discuss about G20. And for that, we have my colleague, Andrea Hurtado. I'm sorry, Andrea, I always misspell your last name. Epstein, who is the Climate Program Manager from Latin America with Healthcare Without Harm. A very warm welcome to you. I know you had a really busy schedule today and you made time, Andrea. So thank you so much. Just walk us through what can we expect on climate and health under G20 this year, and also how is that likely to shape the COP29 process. So welcome again.
Thank you so much, Shweta. And I apologize in advance for my voice. I'm a little bit sick. But I couldn't miss the opportunity to be part of such an amazing panel. So thank you for the invitation. Well, very quickly, I wanted to give you a little bit of context of where we've come from in the work with G20. And some of you might be wondering why G20. It is not a particularly inclusive multilateral process. However, G20 countries represent more than 80% of the world's greenhouse gas emissions. So whatever happens in the G20 context does have extreme relevance for the climate process in other spaces. So this is why there's been a few attempts before to try and influence the G20 process, but I will start from last year's presidency. As you can see in this image, in May last year, some high-level representatives from the World Health Organization, the Asian Development Bank, Healthcare Without Harm, the Oswaldo Cruz Institute, which is Fiocruz in Brazil, a research institute, a very highly regarded research institute in Brazil, and PHFI, the Public Health Foundation of India, published this article in The Lancet on how momentum is building for healthcare climate action. And in that article, they proposed a set of 5 high-level principles for healthcare climate action for the G20 to adopt. And then this translated into what is called a co-branded event in the G20 context, which took place last year in the context of the second Health Working Group meeting in April of 2023 around these high-level principles, which are basically climate resilient health systems, low carbon health systems, the decarbonization of the supply chain, mobilization of finance to deliver on the transition for climate smart healthcare, and finally, of course, the One Health approach, facilitating the collaboration on human, animal, and environmental health challenges. So this, I can't say obviously that this is the sole reason why we had such good results last year with the Indian presidency, but it definitely contributed to what we saw here in the 2023 Health Ministers Communique, which, among other things, stated a commitment from G20 health ministers to prioritize climate resilient health systems as well as sustainable and low carbon health systems. And most importantly, there's a direct recognition of the role that the WHO-led Alliance for Transformative Action on Climate and Health, which has already been mentioned, ATTACH, will play in delivering such changes or climate action in the health sector. And then this translated into language within the New Delhi Leaders Declaration, which is the declaration coming out of the Leaders Summit. So heads of state within this declaration committed to enhancing the resilience of health systems and supporting the development of climate resilient, low carbon health systems, and again recognize the role of ATTACH and the need for G20 countries to support the work of WHO leading on ATTACH. So this was already a milestone in terms of climate and health being addressed by the G20. And this year, with the Brazilian presidency, there's also very exciting news. Already, those of you who were last year at COP28 in Dubai know that during the health day, the very first health day that took place, Brazil's Minister of Health, Nícia Trindade, participated in one of the panels, and there she openly stated that climate and health would be a priority for Brazil's presidencies of both the G20 in 2024 and COP30 in 2025. And so Brazil has delivered on this promise. This year, they included climate change and health as one of the 4 priorities of the Health Working Group for 2024. For those of you who are not familiar with the G20 process, there's the finance track and the Sherpa track. The Sherpa track is where the thematic discussions take place. There's several working groups. One of them is a health working group, and they usually have 3 to 5 priorities each year. So climate change and health is, for the very first time, one of the priorities of the health working group. Now, these discussions are not open to the public, so there's not a lot that can be shared at this stage. But what we can already share with you is that Brazil is planning on delivering as an outcome for this priority within the health working group, a ministerial declaration on climate change and health. It would be, if adopted, it would be the very first of its kind within the G20 space. A 0 draft of this declaration has already been circulated. As you will see in the slide, it includes not just climate change and health, but also language on One Health and antimicrobial resistance. It has already started to be discussed virtually throughout July and August, and another a significant step has been for the Brazilian presidency to establish an additional meeting of the health working group, which will be solely to discuss this proposed declaration. It will take place in Natal, in Rio Grande do Norte, from the 1st to the 3rd of September. And ideally, this will be where the text will be finalized so that it can be adopted by the health ministers meeting, which will take place in Rio de Janeiro on the 31st of October. Just as reflections, I will say a couple things. First is that this already signals Brazil's strong commitment to the agenda, and it is important that we follow the G20 space so that we can make sure that this level of commitment and engagement really carries through from their G20 presidency this year to the COP30 presidency next year, but it's already, again, signaling strong commitment, and we have high hopes for what Brazil might do next year in COP30 in terms of health. The second is that we need to be mindful not to drop our vigilance over the G20 process, so that this engagement that has started with the Indian presidency, it has continued on with Brazil, will carry through to the next G20 presidency, which will be held by South Africa. This is the 4th presidency in a row that is held by a developing country. It was Indonesia, then India, then Brazil, and next is South Africa, which is not as common if you consider the configuration of the G20. So this is really an opportunity to not just continue to address climate and health within the G20 process, which is relevant in and of itself, but also with the perspective of the Global South, which is something that we really look forward to, especially when it comes to not just acknowledging the need to act on climate and health, but also to mobilize the means of implementation for that to effectively happen on the ground beyond G20 countries. And so that's the update on the G20 front, and happy to discuss or answer any questions if there are any. Thank you, Shweta.
Thank you so much, Andrea. That was quick, precise, and comprehensive as ever, like very, very helpful to get this insight. I do recognize that there is a hand in chat, but please hold on to your questions because we have 2 more speakers who are going to reflect a bit on the theme that you narrated, Andrea, which is not just a climate and health, but also One Health and a bigger picture perspective. I would really want them to have their comments in before we get any questions. So our final segment today is looking at the big picture of linking climate justice, environment, health, and human rights. And I'm really pleased to welcome Professor Elisa Morguera, who is the UN Special Rapporteur on Climate Change and Human Rights, and Ana Paula Souza, who is the Human Rights Officer at the Office of United Nations High Commissioner for Human Rights. And a very warm welcome to both of you. And thank you so much for patiently waiting through the session and for this discussion. We really believe that this is a very important discussion. Professor Elisa is also a professor at environmental law, and she's worked extensively on human rights and environment and climate, biodiversity, and climate and ocean nexus. And we're excited to have her over here because we want to see how the climate and health conversation can be seen from a big picture perspective of intersecting with environmental rights, human rights, biodiversity. And in that context, Professor Elisa, what's your view on the intersection, and what's your vision as a special rapporteur? How do you bring these various conversations together under one umbrella?
Yeah, thank you so much, Shweta, and all the colleagues that were on the call. I've learned a lot, so I'm really looking forward to maybe staying involved in this forum as possible. From my side, I think health evidence is going to be crucial, and the more we can connect, I think, health evidence across different sectors for really advancing action and the ambition of action on climate mitigation as well as adaptation, and thinking around real priorities in terms of climate justice for climate financing, capacity building, technology transfer, and loss and damage. I think there's still decision makers, but I think also climate experts and climate scientists who might not understand or share the priority for protecting human rights and shaping climate action through the lens of protecting human rights. And I'm wondering whether that may be partly because they don't have the full familiarity with the relevant health science that help us to understand how each and everyone's well-being is intimately connected to both our failures to make more significant and equitable progress in climate action, as well as in responding to climate impacts, and unfortunately also understanding, anticipating and preventing or minimizing negative impacts on the environment and on human rights of certain climate response measures that have been prioritized. So I'm very keen. I think my priority, my role as UN Special Rapporteur will be twofold. On the one hand, in my own work, in preparing thematic reports, but also any other intervention I will make to support any decision-making process, really sharing as much as possible the health evidence that will be made available to me, and underscoring the legal value of the evidence for identifying human rights implications, for showing obligations of public authorities to prevent foreseeable negative impacts on human rights of decision-making related to climate or that has impacts on climate change. But I think the second role I'd like to play, and of course you have done a lot of this work already, is helping to connect communities of practice and expertise who are not yet either fully aware of the full range of health evidence we have to understand the human rights impacts of climate change, and equally where we need to work more strategically together to either fill gaps, prioritize needs, either for research or for action based on that health evidence.
Thank you so much. Thank you, Professor Elisa. It was really comprehensive and gives us a good sense. I have a very specific, a big moment in the coming months related question. Now, we all know that the Convention on Biological Diversity, COP, is scheduled later this year. And just give us a quick overview of why health and human rights is important in that conversation, and what can the climate and health community do to support the arguments and also support the processes over there?
Yeah, thanks so much for that opportunity. I think maybe a relatively little known fact in international negotiations is that the Convention on Biological Diversity has for more than a decade taken intergovernmental decisions of over 196 parties on climate change. And in my own academic research, I always found that those decisions are very holistic, both in understanding all the triple planetary crisis dimensions of climate change, but equally in taking into account at least some dimensions of human well-being. I think most progress has been made in terms of the socioeconomic and cultural rights of indigenous peoples and other ecosystem-dependent communities. But now with I think the turning point of the global biodiversity framework adopted in 2022 and that recognition of the human right to a healthy environment and a human rights-based approach, I think we will see more explicit and expansive efforts potentially by CBD parties to address human rights, including everyone's human right to a healthy environment, children's human rights, women's human rights, and everyone's human right to health in the context of decisions that have a bearing on climate change. Also, this CBD COP upcoming will adopt is likely to adopt a global action plan on health and biodiversity. And I think the point there is, again, where do we get the more holistic understanding of all the dimensions of health and all the dimensions of biodiversity that gives us then the best and most comprehensive evidence base to then understand our choices in the context of climate change. And in my own earlier academic work, I've always noticed how even in very important conversation on health and the environment, there are certain aspects that always fall behind. One example is the importance of marine biodiversity, both for climate change, which we now have had officially, I think, clarified by the International Tribunal for the Law of the Sea in a groundbreaking advisory opinion earlier this year. But equally, other aspects of biodiversity in terms of global regulatory ecosystem services and other human dependencies on healthy biodiversity, which don't have that much attention in the context of climate change. And so maybe there's another point, I think both that opportunity of engaging in more holistic thinking in the context of the biodiversity regime, and then provided that intergovernmentally backed up approach to the climate regime, which has not been an easy transition to make, I should underscore. But secondly, the fact that CBD COPs are much more participatory spaces than the climate COP and climate intersessional meetings. I have seen and witnessed how independent researchers, civil society, indigenous peoples representatives have opportunities, including in contact groups and working groups, to offer language and in all events comments in real time during textual negotiations. And parties have supported, in different circumstances, those interventions so that they were officially tabled as part of negotiating texts. I mean, to my knowledge, that is quite a unique opportunity for participation and input. And I think many of those interested in climate justice might not have yet taken full advantage both of participating in those negotiations, but then also calling CBD parties who are parties to the Paris Agreement to then fulfill their commitments that have been adopted in the context of the CBD COP. So I think there's some strategic connections to be made in that context.
Thank you so much. That was really indeed quite informative, and I'm sure the participants here have gotten some direction and idea in terms of how to leverage their intervention in the CBD process. On the topic of various processes, I am going to shift my attention to Ana Paula now. Ana Paula, you've been following various environmental processes like the UNFCCC, BRS and Minamata conventions. I want to get some more insights from you because you've been following the plastics treaty, which is still being negotiated. And, the relevance of health and human rights in the plastics treaty conversation and how important it is for the climate and health movement to be aware of that and see how they can support that conversation. What are your insights? What are your thoughts?
Thank you so much for inviting to this space. I want to be more invited. It's really interesting. And there is so much that I would like to comment. And just before commenting on plastics, I just wanted to mention something that was discussed a lot on finance. OHR is promoting a concept of the human rights economy that is exactly looking to how to ring fence economies so they are not spending on that payment, but actually on implementing economic, social, and cultural rights. So we're talking about health, the right to health, the right to food, and so on. There's already a number of civil society organizations that are behind this concept. I'm happy to share afterwards some of the thinking behind that, because I think that is an interesting concept that links with a lot of the processes that have been discussed here. Plastics is like the process that I have been most invested since INC1. I arrived there, understanding that in UNFCCC, even though human rights is still is preambular language, we cannot move. When there was a recognition of the right to a clean, healthy, and sustainable environment by the JA, we got a little change in that preambular text that repeats in every decision pretty much of COP since then. That refers to the right to a healthy environment, but also to the right to health and others. But we see like the climate justice movement is pushed by the movement. And when you go to plastics, and like plastics are fossil fuel, where is human rights in this discussion? And the answer was zero. And there is a process where there is a large environmental justice movement, indigenous peoples, race speakers, frontline, fence line communities, and so on. There was nothing. And we're like trying to understand why. Now we are in a much better position, and we see that there are more references to human rights. States are more open to discuss that, because it's not only coming from OHR saying that this is important, it's reflecting on the realities of the voices that the movement is representing in that space. So right now, what we have potentially could be groundbreaking, because there is language, everything is bracketed, and they hope to finalize in the next meeting. If it's happening or not, there is always wishful thinking, but there is stronger language on in the preamble human rights principles. Human rights is there on the principles, but there are human rights references also under obligations, and they specifically on just transition. And just transition is something that didn't come up much in the discussions on the other issues that were mentioned here, like UNFCCC and so on. But that is something that I would like to recommend that everybody puts on your radar, because there is many actions that are put forward as, part of the just transition, and be on energy, but it can also be in other areas like plastics, that could actually harm communities. And we see this very, very much the case on critical minerals. That doesn't mean that we shouldn't transition. It's just like how we should transition. And that is something that will come strongly in the G20 agenda as well. But going back to the plastics treaty, so we hope that human rights is going to stay. So we are going to have one breakthrough in an MEA where human rights is part of the obligation. But then there is also the discussion on health. Right to health, forget it. There is no way that we can get that through. Human rights is the best we will manage. But there is currently a proposal, 8Bs. There is still 8Bs on health. Encourage the states to do a bunch of things, but it also makes reference to WHO. This is a way forward. I mean, it's better to have something there or not. But the main objective of the treaty, it seems that it's going to stay as that, is to protect health and the environment. So I think health, they have ways to go about. And then, of course, a lot of the discussions that are going there is not only on, having health, having human rights. This is, it's important to be referred in a treaty that is, but we also look into what kinds of obligations of phase out of reducing plastic production, making sure that all the toxics are out of all the chemicals, hazardous chemicals are out of the supply chain and so on. And as we see in climate change negotiations, the same applies on plastics. We see the same dynamics of states, the same positions, and also a big lobby from petrochemicals taking place. And what makes, and I always believe a new treaty is a new opportunity. If we get together, everybody pushing for more ambition, for different modalities of participation of civil society and indigenous peoples, for example, in this treaty, I think there is a way, because we know that we're going to spend years and years and decades on COPs trying to throw it with this treaty, as we are doing with the Paris Agreement. But and on health specifically, I would say that there has been an attempt to do a CRP on health. Unfortunately, there hasn't been many states behind. However, 8Bs as it is there, I think it's being accepted. Let's hope it stays. It's not that strong. I think the language could be a lot more stronger than that. I can talk forever on plastic, so please, Shweta, stop me.
Well, we are 6 minutes over time. I don't want to end this conversation at all, because this has been so enriching. And I think for me, that one common thread across G20, the climate change, human rights, CBD conversation, and plastics is that health invariably is at the heart of these conversations. And now for us in the climate and health community, in the climate justice movement and health justice movement, we need to leverage strategies to make sure that health is front and center, be it in form of medical evidence, be it in form of testimonies from medical and public health professionals, their advocacy. Just strengthen these mechanisms and make sure that health is also part of very clearly shown as reflected in the actions that these treaties, these processes, and these events reflect. Please, I apologize that we didn't get enough time, because I have so many questions, and I'm sure the participants have many more questions. But please consider this as a beginning of an ongoing conversation, because we are going to keep coming back to all of you and inviting you for more such discussions that will help us understand issues better and be creative in creating a coalition, a wider coalition with a common agenda on all the intersecting issues. Really, really grateful that all of you, especially during your vacations and busy work time, have made this time, and very, very really appreciate that. And to the participants, apologize that we went over time, but also because conversation was so amazing. We are quite keen to host another big tent call during this year. This is our second one. We had initially thought of 2, but now we are very encouraged with the response that we've gotten. We want to host another one in the coming months. Please suggest to us what topics you would like to hear to be discussed in these big tent calls, and any specific speakers that you may have in mind that we could invite. And with that, thank you very much, everybody, who for taking this time, for engaging in this conversation. I apologize that I saw hands coming up, but I couldn't invite everybody with their questions, but we will create more spaces for us to have an interactive conversation in the future. We will be sharing the recordings, we will be sharing the slides, and we are happy to facilitate more conversations in the coming months. Thank you so much, everyone, and have a great day.
Thank you, everybody.